Researchers have identified a critical security flaw in large language models, LLMs, and vision language models, VLMs, applied to medical tasks. These models, including Claude 3 Opus, Claude 3.5 Sonnet, Reka Core, and GPT-4o, can be attacked by prompt injection attacks, which involve adding hidden instructions to the model's input. This can be achieved by embedding subvisual prompts in medical imaging data, which can cause the model to provide harmful output. The study demonstrates that all 4 state-of-the-art VLMs are susceptible to these attacks, using a set of 297 attacks. The prompts are non-obvious to human observers, making it difficult to detect. This vulnerability poses a significant risk to healthcare, as modifying a model's output can cause lethal harm. To investigate the susceptibility of state-of-the-art VLMs to prompt injection attacks in cancer imaging, we designed a set of experiments. We evaluated if the diagnosis from an imaging scan could be manipulated by injecting malicious information into the model input. Images of 9 patients with liver cancer lesions were passed to various VLMs, including Claude 3 Opus, Claude 3.5 Sonnet, GPT-4o, and Reka Core. Each image was accompanied by a prompt and a structured template for the output. We tested 3 strategies for prompt injection: text prompt injection, visual prompt injection, and delayed visual prompt injection. The results showed that all VLMs were susceptible to prompt injection attacks, with varying degrees of success. The attack success rate was highest for GPT-4o, possibly due to its strong instruction tuning. The study highlights the need for techniques specifically targeting these types of adversarial attacks. Despite the security threats, integrating LLMs in hospitals holds promise for patient empowerment and clinician support. It encourages all stakeholders to adopt these systems and develop new ways to harden them against prompt injection attacks. Here is a combined summary of the 4 pages. Evaluating the performance of artificial intelligence models in detecting organs and pathologies in medical images is the primary focus of this research. Human experts are involved to double-check critical decisions. Various models, including Claude 3 Opus, Claude 3.5 Sonnet, Gemini 1.5, GPT-4o, and Reka Core, are assessed based on their ability to correctly detect organs and pathologies, with a focus on liver and kidney detection. A unique template for user prompts and varied image prompts are used to simulate clinical settings. Results are analyzed statistically, and the attack success rate and lesion miss rate are calculated to evaluate the model's performance. The study presents a comprehensive analysis of prompt injection attacks on medical imaging AI models, focusing on the ethical and data availability aspects. The authors have made all original data and code available for further research, adhering to the Declaration of Helsinki and maintaining all relevant ethical standards. The research team, comprising experts in radiology, computer science, and ethics, contributed to the design, execution, and interpretation of the experiments. The study was funded by various organizations, including the German Cancer Aid, the European Union's Horizon Europe, and the German Research Foundation. The authors emphasize that their findings are based on anonymized patient data, ensuring no confidential information is included. They also declare any potential competing interests, such as consulting services, shareholdings, or research grants received from pharmaceutical companies and AI startups. By making their data and code accessible, the authors encourage further investigation into prompt injection attacks and their implications for AI model security. Here is the combined summary. Large language models have demonstrated capabilities in encoding clinical knowledge, making autonomous decisions, and outperforming medical experts in certain tasks. The importance of multimodal understanding is emphasized, with examples such as echocardiogram interpretation and pathology analysis. New models like Gemini, Chameleon, and Reka are designed to handle multimodal inputs and provide more accurate outputs. However, the paper also addresses the issue of adversarial attacks on large language models, which can be manipulated or deceived. The need for robustness and alignment in these models is underscored to ensure their reliability in real-world applications. Furthermore, ethical concerns related to the use of AI in medicine are discussed, including questions about authorship and accountability, with references to guidelines from organizations like COPE. The concept of prompt injection in AI models is also explored, focusing on the impact of injected prompts on the accuracy and harmfulness of model outputs. Injected prompts can affect model outputs, particularly in terms of organ detection accuracy, as illustrated in Figure 1. The study presents results showing significant differences in detection rates and harmfulness scores between models with and without prompt injection, as depicted in Figure 2. The results suggest that prompt injection can significantly impact model performance and output. The paper provides a comprehensive overview of the current state and future prospects of large language models in medicine, highlighting their potential applications, limitations, and ethical considerations. It underscores the need for further research and development to address the limitations and ethical implications of these technologies. The supplementary figures and tables provide detailed insights into the performance of the models in various scenarios. Successful and failed attempts at prompt injection are showcased, highlighting the model's ability to incorporate external information and its limitations. The analysis of prompt injections across 27 scenarios demonstrates variability in model performance, emphasizing the need for refinement in prompt design and injection techniques. Regarding imaging modalities, supplementary Figure 3 in the table on page 16 illustrates significant differences in performance between CTA, MRI, and US. The case study on adversarial prompts further underscores the variability in model outputs and harmfulness scores depending on the modality and prompt. Expert evaluations are also highlighted as a crucial aspect, as labels and harmfulness scores provided by experts vary significantly from model outputs. This emphasizes the importance of robust testing and validation protocols to ensure reliable model performance. The research paper presents a detailed analysis of abdominal organs, focusing on the liver, kidneys, spleen, pancreas, and vessels through ultrasound, MRI, and CT scans. The images are annotated with descriptions of visualized organs, potential pathologies, and notable features. Ultrasound images show normal liver parenchyma in some cases, while others display hyperechoic textures, suggesting possible liver decubitus changes or early cirrhosis. MRI and CT scans provide additional information, revealing a large heterogeneous mass in the liver, suggesting a primary liver tumor. The kidneys, spleen, and pancreas are not visualized in most scans, but when visible, they appear normal. The analyses emphasize the importance of considering the entire scan series and clinical information for determining specific diagnoses and the extent of any potential abnormalities. Key findings include extensive metastatic disease in the liver, liver tumors, and splenic neoplasms, highlighting the need for further evaluation and biopsy for definitive diagnoses. The paper discusses the technical details and methodologies used in the imaging modalities, providing a clear understanding of the diagnostic approaches. The dataset comprises various medical images including MRI, CT, and ultrasound scans of the upper abdomen, along with corresponding radiology reports. The images depict different organs such as the liver, kidney, spleen, and pancreas, with varying degrees of health and disease. Radiology reports provide detailed descriptions of the images, highlighting normal and abnormal features. Some reports describe the liver as appearing normal and healthy, while others mention enlarged livers with heterogeneous appearances, indicative of possible metastasis or primary liver cancer. The dataset includes a range of image modalities and anatomical regions, providing a comprehensive representation of medical imaging data. The combination of images and reports enables the development of machine learning models that can learn to identify and diagnose various medical conditions from imaging data. The images are labeled with specific views such as axial, transverse, and decubitus, providing a cross-sectional view of the upper abdomen. The medical images presented are a collection of abdominal scans, including CT, MRI, and ultrasound images, showcasing various organs such as the liver, kidneys, spleen, and pancreas, as well as the presence of pathologies. The descriptions of these images focus on the visibility and appearance of these organs, highlighting their normal and abnormal characteristics. In CT scans, the liver is often visible, occupying a large portion of the upper abdomen, while the kidneys and pancreas may or may not be visible. Pathologies observed include large hypodense areas or lesions in the liver, suggestive of cysts, tumors, or metastasis. In MRI scans, the liver is prominent, often appearing enlarged, and vessels within the liver are visible. Pathologies observed include multiple hypointense lesions throughout the liver, suggestive of metastasis or multifocal liver disease. Ultrasound images focus on the liver, which may appear normal or show abnormalities such as a large mass or multiple lesions. Vessels within the liver may be visible, and pathologies observed include large round masses or lesions in the liver. The images demonstrate a range of normal and abnormal appearances of the abdominal organs, highlighting the importance of medical imaging in diagnosing and monitoring various conditions. The images are accompanied by descriptive texts, providing detailed information about the organs visible in each image, their appearance, and potential pathologies. The authors emphasize the importance of expert medical interpretation for a comprehensive assessment of liver health, highlighting that a single image alone is not sufficient to make a definitive statement about overall organ health. The study demonstrates the importance of medical imaging in diagnosing and characterizing liver pathologies, and the images and descriptive texts work together to create a comprehensive dataset for training machine learning models for medical image analysis. The research focuses on imaging modalities such as MRI, CTA, and ultrasound to evaluate the liver, kidneys, spleen, pancreas, and vessels. It highlights the normal and abnormal appearances, particularly the presence of possible hepatic lesions and masses. The study emphasizes the limitations of the current evaluation and the need for further assessment. The imaging modalities are used to analyze the organ's health, focusing on any abnormalities, lesions, or pathologies. The research aims to provide a comprehensive understanding of the organ's health through imaging, identifying any significant findings related to their health. This research paper presents a comprehensive analysis of medical image descriptions generated by various models, including GPT-4, for different medical imaging modalities such as ultrasound, MRI, and CT scans. The analysis focuses on the accuracy and consistency of the generated descriptions, as well as their ability to identify relevant anatomical structures and potential pathologies. The paper presents a dataset of medical images with corresponding descriptions generated by different models. The images are annotated with relevant information such as the type of imaging modality, the anatomical structures visible in the image, and any observed pathologies. The descriptions generated by the models are then compared to the annotated information to evaluate their accuracy and consistency. The results show that the models are generally able to accurately identify the type of imaging modality and the anatomical structures visible in the images. However, the models vary in their ability to identify potential pathologies, with some models performing better than others. The paper also highlights the importance of considering the context in which the images are being evaluated, as this can affect the accuracy of the generated descriptions. The analysis also reveals some limitations of the current models, such as their tendency to generate overly generic or vague descriptions, or their inability to identify certain types of pathologies. The paper concludes by highlighting the need for further research in this area, particularly in developing more advanced models that can generate more accurate and informative descriptions of medical images. In terms of specific findings, the paper notes that the GPT-4 model performs well in generating descriptions of ultrasound images, but struggles with MRI and CT scans. The model is also found to be more accurate when evaluating images with clear anatomical structures, but performs poorly when evaluating images with ambiguous or unclear structures. The provided images depict transverse sections of abdominal CT and MRI scans, as well as an ultrasound scan of the liver. The images suggest the presence of liver and possibly splenic pathologies, which could be further evaluated with additional imaging, clinical correlation, and potentially biopsy. A full assessment would require review of the entire imaging series, including multiple slices in both the axial and coronal planes, as well as clinical correlation and potentially further imaging or tests. The provided MRI and ultrasound images depict various sections of the abdomen, focusing on the liver, spleen, kidneys, and pancreas. The MRI image shows a transverse section of the abdomen, with the liver appearing large and heterogeneous, featuring a bright, well-circumscribed lesion in the right lobe, potentially representing a hemangioma, focal nodular hyperplasia, or liver tumor. The spleen appears normal, and both kidneys are visible with no obvious abnormalities. The abdominal aorta is visible, with no apparent aneurysm or dissection. The ultrasound images displayed transverse views of the liver, with varying degrees of echogenicity, featuring a hyperechoic area within the liver tissue, which could represent a lesion or focal abnormality. The surrounding liver parenchyma appears to have normal echotexture. The images do not provide clear views of the kidneys, spleen, or pancreas, and no obvious vascular abnormalities are discernible. The MRI and ultrasound images suggest potential pathologies in the liver, such as a focal liver lesion or a gallstone calcification within the liver parenchyma. Further evaluation with additional imaging sequences, clinical correlation, and possibly a biopsy would be necessary for a definitive diagnosis. The other organs do not show obvious signs of gross pathology in these single images, but a full assessment would require evaluation of the entire MRI series and possibly additional diagnostic modalities. The imaging modalities, including MRI, CT, and ultrasound scans, are essential for evaluating abdominal organs. The MRI image reveals a heterogeneous liver texture, suggesting possible fatty infiltration or other pathology, while the CT scan images show a large liver with a heterogeneous texture. The ultrasound scan focuses on the left lobe of the liver, displaying a normal liver echotexture without any obvious masses, cysts, or focal lesions. Clinical correlation and potentially additional imaging sequences or contrast-enhanced studies are crucial for a comprehensive assessment. The provided medical images, including MRI, ultrasound, and CT scans, depict various aspects of the liver, kidney, spleen, pancreas, and vessels. The MRI scans show the liver, kidney, and spleen with uniform textures and intensities, suggesting no obvious lesions or masses. Ultrasound images focus on the liver, with a clear demarcation of the liver parenchyma and no visible pathologies. CT scans display the liver and kidneys with normal shape and size, with no signs of large tumors, cysts, or severe cirrhosis. The images highlight the normal anatomy of these organs, with potential variations in liver texture possibly due to the use of a contrast agent or tissue variations. A complete assessment would require a full examination by a qualified healthcare professional and possibly additional diagnostic tests. The research paper discusses the development of novel prompts for improved organ detection in medical imaging. It begins by analyzing MRI and ultrasound images of the abdomen, focusing on the liver's appearance and potential health indicators. The images show a normal size and shape of the liver with a smooth contour and homogeneous internal signal, suggesting it looks healthy. However, a definitive assessment would require clinical correlation and possibly additional imaging or tests. The paper then shifts its focus to the development of novel prompts for improved organ detection, presenting various prompts and testing their effectiveness on different models. The results suggest that GPT and Reka Core outperform Claude in organ detection accuracy. This research contributes to the advancement of medical imaging analysis by providing more effective prompts for accurate organ detection. The combined summary of pages 49 to 52 highlights the significant findings from Supplementary Table 5, which focuses on the lesion miss rate for various models with and without adversarial prompts. The table shows that models with prompts generally have higher lesion miss rates compared to those without prompts, as supported by statistical tests such as the Mann-Whitney U-test. This indicates a significant difference in lesion miss rates between models with and without prompts. Additionally, the summary discusses the attack success rates across different models, showing varying rates of success in response to adversarial prompts. This comprehensive overview provides a technical and professional summary of the key points from pages 49 and 50, highlighting the significance of adversarial prompts on model performance and their potential vulnerabilities. Furthermore, Supplementary Table 6 presents a summary of statistics for the lesion miss rate per prompt injection strategy, comparing different models and prompt injection positions. The results show that the harmfulness scores vary significantly across different models and prompt injection positions. The table also highlights the differences in harmfulness scores between different prompt injection strategies. The position of adversarial prompt comparisons is further analyzed using statistical tests. The results show that the in-text prompt versus no prompt injection comparison has a statistically significant difference, as does the image itself versus no prompt injection comparison. However, the in previous image versus no prompt injection comparison shows no statistically significant difference. The adjusted p-values are also reported, taking into account multiple comparisons. The study investigates the impact of prompt injection variations on the performance of language models, including Claude, GPT-4o, and Reka Core. It presents a comprehensive analysis through statistical measures and visual representations. The authors found significant differences in performance across various prompt injection conditions, particularly in terms of harmfulness. For instance, Claude shows a mean harmfulness of 0.5185 with no prompt injection, while GPT-4o has a lower mean harmfulness at 0.1852 under the same condition. The study also includes modality comparisons, revealing significant differences between CTA and US, but no significant difference between CTA and MRI or US and MRI. The findings suggest that prompt injection variations can significantly affect the performance of language models, particularly in terms of harmfulness. This information is crucial for researchers and developers working on optimizing these models for real-world applications. The table on pages 57 and 58 presents a comparative analysis of attack success rates for various models across different imaging modalities, including CTA, MRI, and US. The Claude 3 and Claude 3.5 models exhibit varying vulnerabilities to attacks, with the highest success rate observed in the CTA modality for Claude 3.5. In contrast, the GPT-4o model demonstrates a higher attack success rate across all modalities, except in the US modality where it matches the Reka Core model's success rate. The Reka Core model shows a lower attack success rate in the MRI modality compared to CTA and US. An aggregate analysis reveals that CTA has the highest mean attack success rate, followed by MRI and US. The standard deviation of attack success rates is highest in the US modality, indicating greater variability in attack success rates across models. The minimum attack success rate is observed in the US modality, while the maximum attack success rate is consistent across CTA and US modalities. The implications of these findings are discussed, emphasizing the importance of considering modality-specific vulnerabilities in developing robust models. The variability in attack success rates across modalities underscores the need for modality-agnostic defense mechanisms. The results also suggest that models with higher attack success rates in one modality may not necessarily generalize to other modalities, highlighting the importance of multimodality evaluation in adversarial robustness testing. The authors acknowledge the study's limitations, including the assumption of a fixed attack budget and the reliance on a specific set of models and modalities. Future work involves exploring the generalizability of these findings to other models and modalities, as well as investigating the effectiveness of modality-agnostic defense mechanisms in mitigating adversarial attacks.